Welcome to our All About Diabetes. Today's presentation will be about the most important vitamins for diabetic patients. The content of these presentations is based on studies published in medical journals. In no case is it recommended to stop the treatment indicated by your personal medical doctor. The main vitamins with an important role in diabetes are vitamin A and vitamin B. We will start with vitamin A. So the main forms of vitamin A are retinol, which is found in animal tissues, and carotenes, which are found in vegetables. Studies show that high levels of plasma beta-carotene are associated with lower risk of diabetes and that diabetic patients have lower plasma concentrations of vitamin A in carotenoids. Also, urinary excretion of retinol is increased in diabetic subjects. Roles of vitamin A include enhancement of pancreatic beta cell function and hepatic lipid metabolism. It is involved in the health of sight, hearing and taste. Influences cellular differentiation and growth, fetal development, spermatogenesis, immune system and adipogenesis. Also, the retinol binding protein, a protein that transports retinoids, has an important effect on insulin sensitivity. Here you can see a table with recommended daily intakes of vitamin A. So for adults after the age of 19, it is recommended to add 900 micrograms per day for males and 700 micrograms per day for females. Good dietary sources include cod liver oil and turkey liver. The vitamin B complex is very important for diabetic patients. This family of vitamins include 8 vitamins like vitamin B1, vitamin B2, vitamin B3, vitamin B5, vitamin B6, vitamin B7, vitamin B9, and vitamin B12. Thiamine or vitamin B1 is involved in neurotransmission and neuronal conductivity. Low levels of thiamine affect renal clearance. Good dietary sources include beef, liver, dried milk, nuts, oats, oranges, pork, eggs, seeds, legumes, peas. In the table you can see that adults need between 1.1 and 1.2 milligrams per day of vitamin B1. Vitamin B3 has 2 main forms, nicotinic acid and nicotinamide. Nicotinic acid is recommended in dyslipidemia and protects pancreatic beta cells from autoimmune destruction. Nicotinamide preserves residual beta cell function in people with type 1 or type 2 diabetes, improves metabolic control, has potential negative effects on insulin release and insulin sensitivity. Dietary sources include yeast, meat, poultry, red fish, cereals, legumes, and seeds. Pyridoxine or vitamin B6 has 3 main forms: pyridoxal, pyridoxine, and pyridoxamine. It is especially recommended in retinal edema in diabetic patients with non-proliferative retinopathy. So for adults after the age of 19, it is recommended to add 1.3 milligrams per day. Dietary sources of vitamin B6 include chickpeas and beef liver. Biotin, or vitamin B7, is a coenzyme involved in the metabolism of fatty acids, leucine and gluconeogenesis, so it can improve the use of glucose in the body. Dietary sources are liver, peanuts, yeast, whole wheat bread, cheddar cheese, pork, salmon, sardines, and avocado. So for adults after the age of 19, it is recommended to add 30 micrograms per day. Vitamin B12 deficiency is a risk factor for diabetic complications like peripheral neuropathy, retinal edema, and increased light sensitivity in diabetic retinopathy have been found to improve with the supplementation of pyridoxine, folate and B12 combined supplementation. Also, it is important to know that prolonged use of metformin causes cobalamin malabsorption. After the age of 14, it is recommended to add 2.4 micrograms per day of vitamin B12. Dietary sources are clams and liver. Thank you very much for your attention. I hope you enjoyed the presentation. Please like and subscribe.